New videos every day.
This is Athena, and today I'm working on a pregnant lady who is sitting, well, she's lying down, she's propped up in an inclined position. We're just going to work the legs and the feet from this position. The area that should not be handled is right back in here on both sides. There's a lot of reflexes, there's meridians there. It's just always been cautioned ever since I started massage schools that that's an area to basically stay away from. Other than that, I'm going to be applying the oil, and I'm just going to do it with both legs at the same time. The other part that I choose not to work is the inner thigh with any kind of force. There's a lot of lymph nodes, there's a lot of things going on, and I just prefer to stay away from the inner thigh when there's a pregnant woman. And this is just a normal way of working the legs. There's nothing really different about this other than the positioning might be a little different. Maybe some of the routine might be changed a little, but basically the legs are okay to do a normal massage, gently but firmly getting into the muscle around the kneecap and then up into the upper thigh on the outside, as well as the front part of the thigh on the quadricep. And again, I will go closer to the knee on the inner thigh, but as I go up into the inguinal triangle, I move myself away. There's just too many nerves, too many veins, too many lymph nodes for me to want to get in that area with somebody who's pregnant. And the muscles are relaxing out well. On the second leg. Same thing. And getting inside here, picking that muscle up, and also going along the attachment along the bone, the shin. Feels good to get right along that attachment. And same with this side. Sometimes I just press it open this direction. But you can also use some thumb irons and some thumb wagging, as I call it, around the knee and then up into the thigh. Make sure that you keep the oil on. As I had mentioned earlier, I'll mention it again. It's good not to use scent when you're working with a pregnant woman. Unscented oil. I'm careful about the canola oil. Coconut oil is good, except for sometimes it's kind of hard. Olive oil is good, or a combination of good oils. Be mindful of the oil that you do use on people. Mineral oil is not a good idea because it tends to clog the pores. And then we just come back down and can give a little pull on the legs. Just to give a little traction. And when you do this, it's as though you're pulling on the fascia. You're not really pulling on the joints and the bones. You're pulling more on the fascia, giving a little stretch. It feels like you're pulling a piece of fabric tight all the way up the back of the legs. Okay, there we have it.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psychetruth channel.
Mm-mm.